MParachuri from Tennessee State University, and he's given us some information relative to the economic development of the country during President Obama's administration and now his second administration. And Dr. Parachuri, I think that most of us will admit that one of the most important developments during President Obama's administration has been health care. And let's talk about where we were in terms of health care before he became president and where we are moving toward, even though the Affordable Care Act did not go into full effect yet.
Yes. Before Obama took office, became the president, we have 44 million people without any health care. They are not insurable according to the insurance companies. Either they were sick, past record makes them ineligible to be a client for these insurance companies. And these insurance companies see a lot of risk in insuring them. That's why they use all sorts of excuses not to insure number of people. That's one of the major things which the so-called Health Reform Act, which was introduced by our president, is unbelievably very successful, and is going to cover these 45 million people. If they do not have enough income, it is the responsibility of the government to pay the premium. If you can afford, you are expected to pay. So here, this Obamacare, as we all call it now, it was passed in May 23rd of year 2010. There was enormous amount of opposition from the Republicans, but he passed over every objection, and sometimes he had to give up some of the things while he's negotiating with the Republicans, and some of the conservative Democrats too. So he was able, as you all know, he's the most skillful negotiator we have ever had. And the other person, probably other president we can think of, is either John F. Kennedy or Lyndon B. Johnson. But among these, they all tried in the past to have this kind of legislation. They could not get anywhere near to get this because of the opposition, especially from the lobbying by the insurance companies and banks and the others, the other reforms which have been implemented now under the Obama administration. So under this new Healthcare Reform Act, which is also known as Obamacare, we have nearly those 44 million people I was talking about who are not having any health care. They are all covered. They are all covered because of this only. Number of states, especially the Republican governors ruled states, have sued him in Supreme Court. And Supreme Court ruled in favor of the president. So this has become officially a law on that time in May. So ever since that time, even the poorest person in this country, they do not have to worry about their health care. And even though some of us may have to pay a little bit more in terms of the premium when we buy these insurances, it is nice to know that we're not going to be dropped off from the insurance. As some of the insurance companies have done in the past, if you are sick, they'll try to find some excuse and drop you from the insurance. Now, it is illegal for them to drop anybody. So that itself is a major boon for all of us. Whether we are rich or poor or middle income group people, it does not make any difference. Every one of us get the benefit. Even though The upper income group people may be paying a little bit more in terms of insurance premium. But otherwise, average person do not have to pay exorbitant amounts. But one thing is everybody is insured. That is one of the best things which every president for the past 50 plus years have tried very hard even to get the minimum guaranteed, but they were not successful. And thank heavens it is a law now, so nobody has to worry about it.
And the Supreme Court has already declared it to be constitutional, but yet the opposition to such a plan will meet almost annually in Congress and decide to try to repeal it. I mean, does that make any sense? I mean, how do you explain that?
No, it's not that easy. Since it is a law, to repeal the law, it takes a lot more majorities in Congress, and plus, you know.
And so they realize that they really cannot repeal this law, but they do. Well, what about infrastructure developments, Dr. Parachuri? Because I understand that this is one of the major ways that
to
the
increase
economy
the employment. Yes. As a matter of fact, if you go anywhere in the country, including Nashville, you see nothing but highway construction here and there, and number of roads are being blocked for the repairs and all that. That means what? Hundreds of thousands of new jobs in construction. That would mean more smoother roads where you do not have to hit these potholes. And that is one of the major things which has helped, you know, improving our infrastructure. And they are also, the government is also providing a lot of help for the information technology industry by providing them a lot of grants to do a lot of new research, and including the government. You know, government has been also using a lot of this IT technology.
Very good. Of course, Dr. Parachuri, we're getting ready for our second break, and after which time we'll have about 10 minutes. And when we come back, what we'd like for you to do is to continue this discussion in terms of economic development, but also to sort of point us in some direction as to what are some of the possibilities that the president might have in terms of trying to overcome some of the opposition that he has in reference to infrastructure and that kind of thing. Because I think that you've got some information in reference to that. And we'll be back with our audience following this very, very short commercial break. So welcome back to the final segment of the show.